Have you been wondering, how do I get to work in the UK? I don't have any healthcare background and I want to work in the UK. How can I work as a carer in the UK? How can I get the visa? How can I get an employment? If that has all been your questions, so I would say you would not want to miss this whole episode that will be coming up on this channel. I'm going to be talking about everything you need to know about the new healthcare visa that will be rolled out in the UK, and this is not something you want to miss if you want to grab this opportunity. So stick around and you will get to know more on this video. Hello, good morning, welcome back to my channel. Did I just say good morning? I mean, this should be afternoon for some people. Hello, welcome back to my channel. My name is Cynthia and I think most of you do already know me already. So I'm a nurse that works in the UK, and I've got this YouTube channel where I talk about nurses, carers coming to the UK to work and all of that good stuff. But recently I haven't made any content about that, and I've got like requests to make content about that, and I'm not gonna say no to those requests. So I decided to tell you guys about the new health and care worker visa that will be rolled out in the UK. This is the massive, like this is the highest one that we've ever seen and that we are yet to see. So my sincere apologies to everyone that has been looking out for this video from my channel and I haven't met them. So I'm gonna be walking you through the whole thing that you need to do to work in the UK as a health care assistant, even without any background in the health or care or any of those stuff. Step one, create a CV. People just think that, oh, okay, I haven't had this background before and I would like to work in the UK. Okay, I'm just gonna put my CV however it was before and they're gonna take me. No way, no way. If you've not been in the healthcare system before, you have to do some stuff. You know, if you're saying that you want to be employed as a carer, you have to make your CV, channel your CV towards that part. I mean, you can be an engineer, you can be a nurse, you can be whatever, you can be anything you want to be. But when you want to apply for a job, your CV should just be channeled to that particular job you're about to apply for. So for example, if I'm a nurse and I'm going for a nurse job, I have to tweak my CV to channel towards that nursing job that I'm going for. If I am a nurse and I'm also an IT person, if I'm going for an IT job, I should be able to channel my CV towards the IT stuff that I'm going for. So don't leave your CV however it was before. Don't add, oh, I'm an engineer in your CV when you are going for a carer job. Does that make sense? It contradicts each other really. So if you're coming for this job, the first thing is to make sure that your CV is well written. Make sure that your CV is well written. Make sure that you write at least 5 job roles that you've been doing as a carer where you work. 5 things that you know about. Just write something that will make you come out for the interview, that will make them select you for the interview. The competition is intense. You're just not the only person applying for it. People have been waiting for this opportunity to come by, so it's finally here and you don't want to miss it. So what you have to do is to start from your CV. Start from your CV, sound convincing. Make sure you're telling me what I want to hear on the CV. Make sure you're telling them what they want to hear on the CV. So make sure at least you write the responsibilities, the things you've been doing. I will still go into details about the CV maybe in another video, so you know when I make those videos. But first of all, you have to make sure your CV is well written and well detailed and well convincing. Any previous training you've done whilst on this job role should also be added to your CV. So I will still go into details as I said before, but these are the main things that you should write on your CV to be able to excel and become very, very different from others. Step 2, apply for the jobs that are offering sponsorship. So this is where people just get it messed up. This is where I think most people don't really get it. All the employers cannot sponsor people from overseas. all the employers cannot sponsor people from overseas. Some of them can only sponsor people from the UK, some can sponsor from overseas, some cannot. So if you're applying for a job, you should be able to look at the ones that will be able to sponsor you. Step 3 is attending of interviews. So when it comes to attending interviews, there are lots of hints that people should know, because not having a background in health or social care or in the hospital setting doesn't mean that you shouldn't know your job role. That doesn't mean that you shouldn't be able to tell the interviewer what you've done or your experiences or stories that will accompany it. We'll also talk about this in this series, so you have to stick around for it. So the step 4 is, after a successful interview, of course you want the job, right? So the next thing is letter of employment. So if you pass your interview, you get this letter of employment from the employer. I'm not talking about people that go through agencies, I'm talking about people that go directly to employers. And for now, I'm not going to encourage anyone to go through agencies, because you can actually do these stuffs yourself. You don't really need anyone to do it for you, really. But yeah, we'll talk about that maybe in other videos. But the next thing is getting your letter of employment, and this is where the job role, the job code, the salary and everything is detailed. After getting this, we are happy, right? The next thing you should get is a certificate of sponsorship. So this is a certificate of sponsorship is basically a number that you will use to apply for your visa. So you get that from the employer as well. And the next thing you should get at this stage is the contract of employment. So this is where you have to like sit down, understand your employment, understand your contract before signing, because I know many of you are just desperate for the job. Like, we want this job, we don't even look at the contract, and at the end of the day you might find yourself in a box that you can't even get out, or you might find out that you signed the wrong contract or you jumped into it very fastly. In signing a contract, please make sure you look at that contract properly and make sure you're happy with it before signing. The step number 4 is applying for visa, right? So this stage you're almost done with every background job. It's just left for you to apply for your visa, get your decision from the home office, and then start coming, right? So here, if you have a BSc, if you have a degree certificate, you don't have to wait for IELTS, you don't have to wait for English exam to apply. You can simply convert your degree certificate to an English. Yes, you can just convert it, you can just show it as an evidence that you've already had a degree in English and it was taught in English. It's very simple to do, and you get your decision, and you don't have to write English exam. You don't have to spend on writing UKVI General English exam. It's not necessary if you have already had a first degree and that was taught in English. So I know most of you from Nigeria, from Ghana, we are all taught in English in universities, so you don't have to write English exam. Not at all, you don't have to write it. So keep that money for something else. So at this stage, you have to either provide your English exam. If your first degree was not taught in English, you can provide an English exam. So you have to write a UKVI General IELTS. A General IELTS is okay, you don't have to write an academic one. Just like nurses, when they're coming to UK, they have to write the academic one. But in this circumstance, you just need to write your General IELTS and you're good to go. But if you're taught in English in uni, or like your first degree was taught in English, you do not have to write English exam to apply for your visa. You can convert your degree to that, and then you can apply and get your visa. Step number 5 is getting your police certificate, and this lasts for 3 months. So the validity is for 3 months, so you have to get it like close to the time you're applying for the visa. Step number 6 is get your tuberculosis test done. The next thing is completing your visa application online, and it's pretty easy. You have to do everything yourself. Just complete online, go for your appointments, go for the submission. You don't really need anyone to do these things for you. Like, you can actually do them yourself, and it's being done online. And I always tell people that Every information you need is online. Google is your friend. You can always ask Google anything, and when you have like doubts, you can now ask people. At this point, you may be required to pay some application fee for your visa. Previously there is a fee called the IHS, and this is the point you have to pay it, because the carers are now added to the health and care visa, so you don't have to pay for this. If someone is asking you to pay for it, just know that that is a scam. You don't have to pay for IHS anymore. Then the last thing is, at this point you may be required to have some money in your account. So this is coming from someone that I know that have already got this job and about to come to the UK through the healthcare visa. So he was required to have some certain amount of money in his account. Some employers may be happy to certify that they will look after you and maybe cover for your maintenance and all of that, just as how nurses are being done for. So this is basically the rundown of everything from the step 1 to the last step of what you should do to get into the new health and care visa. So this will be started formally on the 15th of February, and that will be next week. So get your guests ready, get everything ready, start your application now, and make sure you follow this channel, because I'll be telling you more about what you should do and what you shouldn't do, so you don't miss this opportunity as well. It's gonna last just for 12 months. Just for 12 months. It's not gonna last forever, just for 12 months. So you have to make sure you get everything ready and you don't spend money and at the end of the day you don't get it. So thank you for watching, and make sure you check out the description box, because I'll be leaving some link over there, and I'll continue leaving some link on the description box whenever I do this type of videos, so you help yourself as well and get the whole info you need. So thank you for watching, and I will see you the next time. Bye.